ADR एडवर्स ड्रग रिएक्शन के MCQ देखने वाले हैं। फर्स्ट MCQ है, व्हाट इज द कैरेक्टरिस्टिक्स ऑफ अ टाइप ए एडवर्स ड्रग रिएक्शन। Characteristics of type A adverse drug reaction: first, unpredictable and unrelated to dose; second, predictable and dose dependent; third, always immune mediated; fourth, occur only with long term use. इसका आंसर है सेकेंड, प्रेडिक्टेबल एंड डोज डिपेंडेंट। टाइप ए एडवर्स ड्रग रिएक्शन प्रेडिक्टेबल एंड डोज डिपेंडेंट। टाइप बी अनप्रेडिक्टेबल। Second question, type B adverse drug reaction are best described as: first option, dose dependent and common; second, unpredictable and often idiosyncratic; third, always reversible upon drug discontinuation; fourth, related to the drug's therapeutic effect. Answer है second, unpredictable and often idiosyncratic. Type B adverse drug reaction unpredictable. Type A predictable. Third question, which of the following is an example of type A reaction? एग्जाम्पल कौन सा है टाइप ए रिएक्शन का? फर्स्ट, एनाफिलेक्सिस टू पेनिसिलिन; सेकेंड, हाइपोग्लाइसेमिया फ्रॉम इंसुलिन ओवरडोज; थर्ड, स्टीवन जॉनसन सिंड्रोम फ्रॉम सल्पोनामाइड्स; फोर्थ, हेमोलाइटिक एनीमिया इन G6PD deficiency. Example of type A reaction is hypoglycemia from insulin overdose. Second answer correct. Type B reaction are often associated with: first, pharmacological effect of the drug; second, genetic or immunological mechanism; third, higher therapeutic index drugs; fourth, chronic drug administration. Type B reaction are often associated with genetic or immunological mechanism. Answer correct is second. Pharmacological effect of drug. Pharmacological effects of the drug reactions are often associated with type A reactions. Fifth, drug tolerance is best defined as: first, an exaggregated response to a normal drug dose; second, an allergic reaction to a drug; third, a predictable side effect of a drug; fourth, a genetic mutation caused by a drug. Drug intolerance is best defined as an exaggregated response to a normal drug dose. Answer is first. Next question, which of the following is an example of drug intolerance? Drug intolerance का example: first, tinnitus after a single dose of aspirin; second, anaphylaxis after penicillin administration; third, liver failure from acetaminophen overdose; fourth, photosensitivity from tetracycline. इसका आंसर है फर्स्ट, tinnitus after a single dose of aspirin. Next question, drug intolerance differ from a typical ADR adverse drug reaction because it: first, occur at higher than normal doses; second, require prior sensitization; third, occur at therapeutic doses in sensitive individuals; fourth, is always life threatening. इसका आंसर है थर्ड, occur at therapeutic doses in sensitive individuals. Next question, which patient group is most likely to experience drug intolerance? First, patient with the history of drug allergies; second, patient with genetic predispositions; third, patient on multiple medications; fourth, patient with no prior drug exposure. Answer is second, first, patients with genetic predispositions. Next question, idiosyncratic drug reactions are characterized by: first, predictable dose dependent effects; second, unpredictable, often genetically determined responses; third, common side effect of the drug; fourth, immune mediated hypersensitivity. Idiosyncratic drug reactions are characterized by unpredictable, often genetically determined responses. Second option is correct. Next, an example of an idiosyncratic reaction is: first, hemolytic anemia in G6PD deficiency with primaquine; second, nausea from chemotherapy; third, hypotension from excessive डायरेटिक यूज। फोर्थ, रैश फ्रॉम पेनिसिलिन एलर्जी। इसका आंसर है फर्स्ट, हेमोलाइटिक एनीमिया इन G6 PD deficiency with primaquine. Next question, idiosyncratic reaction are most likely due to first, overdose of the drug, second, genetic or metabolic abnormalities, third, prolonged drug exposure, fourth, drug-drug interaction. Idiosyncratic reaction are most likely due to genetic or metabolic abnormalities. इसका आंसर करेक्ट है बी। बी ऑप्शन इज करेक्ट। नेक्स्ट, which drug is commonly associated with idiosyncratic liver injury? Which drug is commonly associated with idiosyncratic liver injury? First, acetaminophen, second, isoniazid, third, aspirin, fourth, metformin. इसका करेक्ट आंसर है सेकेंड, isoniazid. Next question, which type of drug allergy is characterized by IgE-mediated reaction? IgE-mediated reactions. First, type A, immediate hypersensitivity. Type second, cytotoxic. Type third, immune complex mediated. Fourth, type 4, delayed hypersensitivity. इसका आंसर है फर्स्ट, टाइप ए, immediate hypersensitivity. Drug allergy is characterized by IgE-mediated reaction is type first, immediate hypersensitivity. Anaphylaxis is an example of which type of drug allergy? First, type 1, second, type second, third option type third, fourth option type 4. Anaphylaxis is an example of type first. First option is correct. Next question, type second drug allergies are associated with first, immune complex deposition, second, T cell mediated reactions, third, antibody mediated cytotoxicity, fourth, immediate histamine release. इसका आंसर है एंटीबॉडी mediated cytotoxicity. Next question, which of the following is an example of a type 4 drug allergy? टाइप 4 ड्रग एलर्जी का एग्जाम्पल कौन सा है? फर्स्ट, कॉन्टैक्ट डर्मेटिटिस फ्रॉम टॉपिकल न्यूमाइसिन, सेकेंड, हेमोलाइटिक एनीमिया फ्रॉम मिथाइल डोपा, थर्ड, सीरम सिकनेस फ्रॉम पेनिसिलिन, फोर्थ, अर्टिकेरिया फ्रॉम अमोक्सिसिलिन. इसका आंसर है फर्स्ट, कॉन्टैक्ट डर्मेटिटिस फ्रॉम टॉपिकल न्यूमाइसिन. ये टाइप 4 ड्रग एलर्जी का एग्जाम्पल है. नेक्स्ट क्वेश्चन, फोटोसेंसिटिविटी रिएक्शन टू ड्रग आर प्राइमरली कॉज्ड बाय फर्स्ट, drug accumulation in the liver, second, drug interaction with ultraviolet light, third, immune mediated skin reaction, fourth, drug overdose. इसका करेक्ट आंसर है सेकेंड, ड्रग इंटरेक्शन विद अल्ट्रावायलेट लाइट. नेक्स्ट क्वेश्चन, विच ड्रग इज मोस्ट कॉमनली एसोसिएटेड विद फोटोसेंसिटिविटी? फर्स्ट, टेट्रासाइक्लिन, सेकेंड, मेटफॉर्मिन, थर्ड, atorvastatin, fourth, lisinopril. Which drug is most commonly associated with photosensitivity is tetracycline. First option is correct. Photosensitivity reaction are classified as type A adverse drug reaction, second option type B adverse drug reaction, third option type C adverse drug reaction, fourth option type D adverse drug reaction. Photosensitivity reaction are classified as type B adverse drug reaction. Second option is correct. Next question, a patient develops a rash after sun exposure while taking a drug. This is likely first, photosensitivity, second, photoallergy, third, both A and B, and fourth, neither A and B. इसका आंसर करेक्ट है थर्ड ऑप्शन, both A and B. Drug dependency is characterized by first, physical or psychological need for a drug, second, immediate allergic reaction, third, predictable side effect, fourth, genetic predisposition to ADRs. Drug dependence is characterized by physical or psychological need for a drug. First option is correct. Next question, which drug class is most commonly associated with dependence? First, opioid, second, antibiotic, third, antihypertensive, fourth, antidiabetic. Which drug class is most commonly associated with dependence? Opioid. First option is correct. 23 नंबर का क्वेश्चन, psychological dependence differs from physical dependence because it first involves withdrawal symptoms, second is driven by craving rather than physiological need, Third, is always reversible. Fourth, occur only with illegal drugs. इसका correct answer है second, is driven by craving rather than physiological needs. Which of the following is a sign of drug dependence? Sign of drug dependence. First, tolerance requiring higher doses. Second, photosensitivity after a drug use. Third, anaphylaxis upon drug exposure. Fourth, mutagenicity is offspring. Sign of drug dependence, tolerance requiring higher doses. First option is correct. Next question. Drug withdrawal symptoms are most likely to occur with. Drug withdrawal symptoms are most likely to occur with first, short-term antibiotic use, second, chronic use of benzodiazepines, third, single-dose analgesic, fourth, topical corticosteroid. Correct answer is second, chronic use of benzodiazepines. Next, which symptoms is commonly associated with opioid withdrawal? Symptoms associated with opioid withdrawal. First, seizure. Second, sweating and diarrhea. Third, photosensitivity. Fourth, liver failure. The correct answer is second, sweating and diarrhea. Next question. Withdrawal symptoms are best managed by. Withdrawal symptoms are best managed by first, abrupt discontinuation of the drug. Second, gradual dose tapering. Third option, switching to a different drug class. Fourth option, increasing the drug dose. Correct answer is second, gradual dose tapering. Withdrawal symptoms are best managed by gradual dose tapering. Next question. Which drug is associated with severe withdrawal symptoms including seizure? First option, alcohol. Second, penicillin. Third, metformin. Fourth, aspirin. Drug is associated with severe withdrawal symptoms including seizure is alcohol. Correct answer 28 का first, alcohol. Next question, teratogenicity refers to first, drug induced cancer. Second option, drug induced birth defect. Third option, drug induced mutations in DNA. Fourth option, drug induced liver damage. Teratogenicity refers to drug induced birth defect. Correct answer is second option. Which drug is a notoriously teratogenic and causes phocomelia? First, thalidomide. Second, aspirin. Third, penicillin. Fourth, metformin. Drug is notoriously teratogenic and causes phocomelia is thalidomide. Correct answer is first. 31. Teratogenic effects are most likely to occur during first, the third trimester of pregnancy. Second, the first trimester of pregnancy. Third, postpartum period. Fourth, preconception period. Correct answer is second, the first trimester of pregnancy. Mutagenicity refers to a drug's ability to first option, cause birth defect. Second, include DNA mutation. Third, cause cancer. Fourth, induce immune reaction. Mutagenicity refers to a drug's ability to induce DNA mutation. Correct answer second. Which drug class is most commonly associated with mutagenicity? First, alkylating chemotherapeutic agent. Second, antibiotics. Third, antihypertensive. Fourth, antidiabetic. Drug class is most commonly associated with mutagenicity. Alkylating chemotherapeutic agent. First option is correct. Mutagenicity is typically assessed using first, AMES test. Second, patch test. Third, skin prick test. Fourth, blood glucose test. Mutagenicity is typically assessed using a AMES test. First option is correct. 36. A mutagenic drug primarily affects first, somatic cells only. Second, germ cells or somatic cells. Third, immune cells only. Fourth, liver cells only. A mutagenic drug primarily affects germ cells or somatic cells. Second option is correct. 37. Carcinogenicity refers to a drug's ability to first, cause allergic reaction. Second, induce tumor formation. Third, cause birth defect. Fourth, induce withdrawal symptoms. Carcinogenicity refers to a drug's ability to induce tumor formation. Second option is correct. Which drug is associated with an increased risk of carcinogenicity? First, cyclophosphamide. Second, paracetamol. Third, lisinopril. Fourth, amoxicillin. Correct answer is first, cyclophosphamide. 39. Carcinogenic drugs are most likely to affect first rapidly dividing cells, second non-dividing cells, third immune cells only, fourth red blood cells only. Carcinogenic drugs are most likely to affect rapidly dividing cells. First option is correct. 40. Which drug is associated with drug-induced lupus erythematosus? Which drug is associated with drug-induced lupus erythematosus? First hydralazine, second metformin, third amoxicillin, fourth atorvastatin. Correct answer is first hydralazine. What is the primary difference between the side effect and a toxic effect of a drug? Difference between side effect and toxic effect. First, side effects are always harmful while toxic effects are beneficial. Second, side effects are unintended but not necessarily harmful while toxic effects are harmful. Third option, side effects occur only at low doses while toxic effects occur at high doses. Fourth option, side effects are predictable while toxic effects are unpredictable. Correct answer is second. Side effects are unintended but not necessarily harmful while toxic effects are harmful. साइड इफेक्ट हार्मफुल नहीं होते, टॉक्सिक इफेक्ट हार्मफुल होते हैं. 42. Which of the following is an example of a secondary effect of a drug? First, nausea caused by chemotherapy. Second, antihistamine causing sedation while treating allergic. Third, kidney damage from prolonged NSAID use. Fourth, anaphylaxis from penicillin. Correct answer is second, antihistamine causing sedation while treating allergic. 43. Which of the following best describes the toxic effect of drug? First, drowsiness after taking a sedative. Second, liver failure due to acetaminophen overdose. Third, dry mouth from an anticholinergic drug. Fourth, improved mood from an antidepressant. Correct answer is second, liver failure due to acetaminophen overdose. 44. A patient taking a beta blocker for hypertension experiences fatigue. This is an example of first, therapeutic effect, second, a side effect, third, a toxic effect, fourth, a placebo effect. Correct answer is first, side effect. 45. Which of the following is most likely to cause a toxic effect? First, taking a single dose of an over-the-counter antihistamine. Second, chronic use of high-dose corticosteroids. Third, applying a topical antibiotic for a minor cut. Fourth, taking a multivitamin daily. Correct answer is second, chronic use of high-dose corticosteroids. 46. A patient on warfarin experiences excessive bleeding. This is classified as first, side effect, second, secondary effect, third, a toxic effect, fourth, a therapeutic effect. Correct answer is third, a toxic effect. Which of the following is a common side effect of a opioid analgesic? कौन सा साइड इफेक्ट ओपियोइड एनाल्जेसिक का है? फर्स्ट, इंक्रीज्ड एपेटाइट. सेकेंड, कॉन्स्टिपेशन. थर्ड, हाइपरटेंशन. फोर्थ, हाइपरग्लाइसीमिया. Side effect of opioid analgesic is constipation. Second option is correct. A secondary effect of a drug is best described as first, an effect that occur only at toxic doses. Second, an unintended effect resulting from the drug's primary pharmacological action. Third, an effect that is always harmful to the patient. Fourth, an effect that is primarily therapeutic goal of the drug. Correct answer is second, an unintended effect resulting from the drug's primarily pharmacological action. 49. Which of the following drug is most likely to cause a toxic effect on the kidney? First, ibuprofen taken chronically at high doses. Second, low dose aspirin taken daily. Third, short term use of antihistamine. Fourth, topical corticosteroid from eczema. Correct answer is first, ibuprofen taken chronically at high doses. 50. A patient experiences hair loss while on chemotherapy. This is an example of first, a therapeutic effect, second, a side effect, third, a secondary effect, fourth, a placebo effect. Correct answer is a side effect. Hair loss is a side effect.